Hello, everybody. My name is Yaa Kumah-Crystal. I'm a pediatric endocrinologist and biomedical informaticist, and I'm so pleased to be here today. I want to thank my dear friend Jon Stine and Harry for having me and representing the Open Voice Network. I would like to have a discussion today about voice and its role in health and where we are in this journey where voice is more than just a tool that you and I use to interact with each other, but is now also a tool that we can use to interact with our machines. As a pediatrician, I see lots of patients every day, and I always have to gather my thoughts together and put them in the computer so that I can go back to my notes and read them and other people can have access to my notes. Well, with emerging technologies now like ambient scribes, we're in a place where as opposed to the doctor that you see that you took all day to schedule and sit in the waiting room will actually be present for you during your clinic encounter. They won't be turning their backs to type on their computer. They can actually sit with you, make eye contact, and have a full conversation. And these are the kinds of remarkable things that we're really trying to move forward as voice and natural language processing becomes part of the natural way we interact with computers. One of the interesting things about voice and the journey to get to a place where it's just part of what we do is make sure that we have good trust and reliability in our systems. The funny thing about voice and speech is that we all know how to talk. Therefore, we all have expectations of what we expect to hear back and how timely things should be when we ask a question to someone else. And making sure that we can actually have experiences that are similar to that when we're talking to our machines. Historically, to communicate with our machines, our computers, we would have to tell the computer in so many words using keystrokes and the command line what we were thinking. But things have really evolved where if I want to tell my computer that I'd like to order some metformin for my patients, as opposed to clicking to the right screen and clicking in the right box and typing in the right phrase, I can use my words and say, please order metformin for my patients. And it can actually understand the things I say. And that is just such a remarkable experience to have, to be able to not have to adapt yourself to a computer so that it can understand you, but rather the computer adapting itself to us so that it can understand what we're saying and what our needs are. As a patient, having voice as a tool in health just really lowers the barrier to get access to health information. Electronic health records and patient portals are emerging now as ways patients can go in and see their information. But sometimes the barrier of entry for a computer can be challenging for some folks. But again, everybody knows how to speak. So if a patient could simply access their health information by saying, hey, order my prescription or call my doctor or look up information about diabetes and have that information presented to them that's contextually aware, that understands who they are, what their risk factors are, and present that information in a way that they can fully appreciate what the next steps are in their care, that would be so remarkable. And in health, you always think about privacy and confidentiality. What if we could have systems that not only could understand the words you say, but could also authenticate your words by understanding how you sound, the inflection points in your voice, and would only respond appropriately to you based on the questions you ask. When my mom calls me, I definitely know it's my mom because she has a certain way of speaking. She has a certain way of saying my name. And I think we can teach our computers to be just as smart and just as witty. So I think we're at a really important point in technology where we have the opportunity to let our computers be partners in the way we deliver health, the way we learn about health. With regards to things like remote care models, having the opportunity to let voice and speech help to facilitate aging at home, having the ability to just simply ask for things like the lights to be dimmed, simply ask for things like calling a loved one to have them check in on you, but also the other way around, having reminders to take your medication, letting you know that you have a message that has come in from your physician. These little things that we take for granted because, every day you're on your phone and you get these alerts and things like that. But having it just more of a part of the workflow of how you're living your life so that at any time you can just ask for the things you want and get that information back could really, really help folks be more engaged and get more out of their experiences and get more out of their medical records than currently are today, where it's a whole process to log in. An important thing that we need to keep in mind as we design these voice experiences and we try to engage more people in using these tools is expectations. Everybody knows how to talk. Everybody knows what you would expect to hear back when you ask a certain question. So just being mindful that you need to make sure you're meeting people's needs and understanding what they're asking and why they're asking it, having the context of what their conditions are, having the context of what they've asked before, to make sure that you're able to deliver the relevant information, because at the end, that's what really matters. When you're opening your mouth to say your words, that takes time and energy. You're using your breath and you want to make sure you're not wasting your breath. So the answers back have to be really rewarding for folks to continue to engage in these experiences. So I would love to continue to think through with you all just the many ways that voice can help us deliver care more effectively to our patients. I, as a physician, have been taking advantage of voice assistant tools in my care or delivery work, where I can say, order a cholesterol, order an A1C, what's the patient height, and have that information right there to me. So when I'm talking to my patient, I don't have to leave what we're doing to interact with the computer, because the computer is now my buddy. The computer is the thing that's listening to me and understanding me and delivering the orders and requests that I have. So I think we're at the next phase in care. We're at the next phase in technology, where voice is this amazing new operating system that can really help us take care to the next level. Thank you so much for your time. If anyone wants to reach me to talk more about voice, you can contact me at yaakuma@gmail.com. Have a wonderful day, everyone.